Hello everyone, welcome to another NP Academy lecture. Today we will talk about this new drug called Paxlovid. This is the first oral drug for COVID-19. We will discuss what this drug is, how this drug works, what are the dosing regimen, who should be getting it and who should not be getting it. So let's talk about it. We'll talk about Paxlovid. This drug actually came from Pfizer, and FDA has given this medication emergency use authorization based on the phase 2 and phase 3 clinical trial that came from Pfizer. So this drug has not received the FDA approval as of yet, but it does receive the emergency use authorization. So let's talk about the clinical trial that they did. In the phase 2 and phase 3 clinical trial, what Pfizer did is that they enrolled 2,246 patients. And some of the criteria for these patients were that they all had positive COVID test, and this was their first COVID infection. None of them had any prior COVID infection, so no prior COVID-19 infection, and they were all not vaccinated, they were all unvaccinated, so no vaccine, unvaccinated. They all had a mild to moderate symptoms, with at least one risk factor that predisposes this patient to get the severe COVID-19 infection, severe COVID-19. And we will talk about these risk factor later in the talk. Okay. And of course, this was a double-blinded placebo-based trial, so they randomized it. Part of patient received the Paxlovid and part of them received the placebo, and they gave this medication for 5 days, and then they monitored them for the next 28 days. And at the end of 28 days, they looked for the risk for hospitalization, or death. Basically, they all had a COVID-19. A group received Paxlovid, another group received placebo. How many of them got sick of the COVID-19 to get hospitalized, or how many died of COVID-19? And at the end of 28 days, what they found that in the Paxlovid group, Paxlovid actually decreased the risk for hospitalization or death by 89%. So there was 89% reduction in the hospitalization or death in a Paxlovid group compared to placebo group. Then they look for the death. In the death, when they look for the death, there were 12 deaths happened, and they were all in the placebo groups. In the placebo group, there was 12 deaths. In the Paxlovid group, there was 0 death, no death at all. So based on these data, this kind of very strong and encouraging data that Paxlovid treatment actually reduced the hospitalization or death due to COVID by 89%, and there was no death whatsoever. So based on this data, FDA gave this drug emergency use authorization to use for the COVID-19 patient. Okay, well, so how the Paxlovid work? So the mode of action. To understand how this medication work, let's see how actually the virus infect the human cells and how virus actually replicate inside the human cells. So as you probably know, so that this is your COVID-19 virus. It has a nucleic acid inside it, that is your mRNA, and it has a spike protein on top of the like this. And then let's draw, this is your human cells, and human cells has this ACE2 receptor. This is your ACE2 receptor, and this SARS-CoV virus actually interact with this ACE2 receptor and infect the cells. This is your human cells. Once the virus comes inside the cells, this nucleic acid, this is your messenger RNA, mRNA, it released from the virus. Okay, and this nucleic acid actually forms this something called protein. It forms multiple different proteins. So let's change the color here. It forms on this protein here. So this is your protein, and this is your mRNA, messenger RNA from the SARS-CoV-2. Now this protein has to be broken down into a small pieces, into the small peptide fragment. This is a part of viral replication, and these small peptide actually come together and form this enzyme, something called replicase. And this replicase actually, after multiple steps, it forms the SARS-CoV-2 virus. So that's how this virus actually replicate inside the cell. Which are the ones that they infect the human body. It's a little bit more complicated than this, but this is, I can try to simplify it here. So this is the replication process of virus inside the human body. Well, this breakdown of protein into this small peptide, this is mediated by enzyme called protease. And this protease is also made by this viral mRNA. This is a little bit complex steps here. So the virus has a multiple mRNA, some mRNA forms the protein, and some other mRNA form different kind of protein. So this protein actually came made from the mRNA of the virus, and this protease go ahead and they cleave this protein at a specific site to forms this small peptide. What this Paxlovid does actually, that your Paxlovid, what Paxlovid does, that Paxlovid actually inhibit this protease. So if this protease is not there, this step, the breakdown of this larger protein into the smaller peptide that actually forms the replicase, this never happened. So as a result, none of these happen actually. So that's how once you stop this, inhibit this protease, it actually inhibit the viral replication, and that's how virus doesn't grow. So this is the very powerful drug. As you can see, that this Paxlovid actually work at the very earliest stage of the viral replication. So this is how Paxlovid work. Okay, well, so who should be getting this medication? So who should be getting it? Who to prescribe this medication? Well, as of now, this medication is for anyone who is older than 12 years of age. So the minimum age requirement is 12 years. So 12 years or older. A minimum weight requirement is 40 kilogram, that turn out to be 88 pounds roughly. A patient has to have the positive COVID test. You have to have a positive COVID test, and you need to start this medication within the first 5 days of onset of symptoms. So first 5 days of onset of symptoms. And this patient is for the outpatient treatment. So if the patient is hospitalized, they won't get it. So the patient has to be an outpatient. And the patient, they came up with this guideline that this is indicated for the patient who has a mild to moderate symptoms. So they are not really very sick, but mild to moderate symptoms with at least one risk factor that predisposes this patient to get the severe form of COVID-19, severe COVID-19 infection. Well, so what are those risk factors? What are these risk factors that predisposes this patient to get the severe COVID-19 infection? So CDC has a list of these risk factors that predispose this patient. And some of the most common risk factor is obesity. So anyone of BMI of more than 25, they you should be prescribing this medication. Anyone who has a history of diabetes, whether it's a type 1 or type 2, anyone who is a smoker, whether it's a current smoker or former smoker, anyone who does the like drug abuser, so who use a drug user, anyone who has a like heart disease like hypertension, CHF, coronary artery disease, anyone who has a lung disease like your COPD, asthma, cystic fibrosis, any kind of cancer, history of stroke, CVD. So as you can see, this is a very broad list. So if the patient comes to you, if they have a COVID-19 infection and they reach out to the provider, chances are very high that they will meet at least one of these criteria. So if they are in the first 5 days of onset of symptoms, I think it's reasonable to start them on Paxlovid. Okay, so these are some of the criteria for the patient. Okay, well, what are the dosing regimen? Let's look at the dosing regimen that is for the Paxlovid. So dose. Well, Paxlovid actually is the combination of 2 different drugs. So Paxlovid come in the pill pack. There are 2 different drugs. One of them is called, let's change the color here. One of them is something called nirmatrelvir. I apologize for my pronunciation. As you can see, it's kind of very complicated. So Paxlovid has two drugs. One is the nirmatrelvir. The another one is ritonavir. And in this pill pack form, there are this nirmatrelvir. It comes like 150 milligram tablet, and there are 2 tablets in it. And the ritonavir comes 100 milligram tablet, and in the pill form there is 1 tablet in it. This nirmatrelvir, this is the drug that it actually has the anti-SARS-CoV-2 activity. So when we talk about this protease inhibitor here, this is caused by the nirmatrelvir. So this is the drug that actually decrease the SARS-CoV-2 viral replication. Ritonavir, it does not have any activity against SARS-CoV-2. What ritonavir does is that it slows down the metabolism of nirmatrelvir inside the human body. By doing this, what the ritonavir does is that this allows the nirmatrelvir to stay in the body for longer time and at higher concentration, and thus it becomes more effective in clearing the SARS-CoV-2 virus. So that's what it does. So typical dosing regimen for the general normal healthy individual will be that you will use nirmatrelvir. You will use nirmatrelvir 300 milligram. So since in the pack comes with the 150 milligram tablet, we'll have to take 2 tablet of this, and you will get the ritonavir 100 milligram, that is your 1 tablet. So total you will be taking 3 tablet. So total you will be taking 3 tablet, and you will take this twice a day, BID, that means twice a day for 5 days. So this is the typical dosing regimen for the healthy individual. However, if you have a moderate renal dysfunction, and so if your GFR is little low, so if the GFR is between 30 to 59, this is a moderate renal dysfunction. In this case, you have to take the nirmatrelvir. So where you will take 150 milligram, that is only 1 tablet, and ritonavir you will take 100 milligram, that is 1 tablet. So here you are taking a total of 2 tablet, and again twice a day for 5 days. So with the renal dysfunction with the GFR between 30 to 59, you take only 1 tablet, 150 milligram of nirmatrelvir and 100 milligram, that is 1 tablet of ritonavir twice a day for 5 days. If your GFR is less than 30, if the GFR is your less than 30, this medication is contraindicated. Do not prescribe them. This is your so basically less than GFR less than 30, no Paxlovid. You do not want to give them. It's contraindicated at this time. Paxlovid. Well, who should also not be getting this medication? So who should not be getting it? So as of now, this medication is not for the hospitalized patient. So if patient is sick enough to be in the hospital, hospitalized, no Paxlovid. No Paxlovid. If this medication is not for prophylaxis, so for either pre-exposure or post-exposure prophylaxis, no Paxlovid. So Paxlovid at this time is not indicated for either pre-exposure or post-exposure prophylaxis, or for any hospitalized patient if they have too much of a severe infection. Okay. Well, another thing to know about is the contraindication. So let's look into the contraindication. Contraindication. So Paxlovid is metabolized by cytochrome P450 metabolism system, and there are a lot of other drugs that actually metabolized by cytochrome P450. So because of that, there are a lot of drug to drug interaction, and there are several contraindications. That means you do not want to use Paxlovid with certain drug. That's the contraindication means. So at this time, what FDA is saying that, well, this drug Paxlovid should not be used with amiodarone. So let's keep this red. So amiodarone, this Paxlovid is contraindicated with amiodarone because it increases the risk for arrhythmia. Also, no Paxlovid with colchicine. Colchicine, as you probably know, that we use it in the gout treatment. This Paxlovid is not indicated with anyone who take any kind of a statin like simvastatin, lovastatin. A statin is rather a very common drug, and what they found is that if you use the Paxlovid with statin, it induces the risk for rhabdomyolysis, myopathy. So what FDA has said at this time, that if you are taking a statin, then stop the statin for at least 12 hours and then take Paxlovid, and while so because it's contraindicated. There are several other like psych medication like Latuda, Lorazepam, Latuda, Clozapine. Paxlovid also contraindicated with these. Some anti-seizure medication like phenobarbital, phenytoin, carbamazepine. This is also contraindicated. This herbal drug, the St. John worts, that's also contraindicated with Paxlovid. So there is a list of all the drug that make interaction with Paxlovid, and where you want to either closely monitor the drug, like say for example if somebody is on the warfarin, you want to, and you put them on the Paxlovid, you have to closely monitor the INR. So there's a list on this website. I highly encourage you guys to have a look. This is www.fda and .gov.media/155050 download, and you should be able to download this entire list where it shows about what are the drugs that are contraindicated, or sometimes you have to closely monitor it. And these are the someone that I pick a few drugs because these are the most common one. So here you have it, the new oral drug for COVID-19 called Paxlovid. The usual dosing regimen is the 300 mg of nirmatrelvir, 100 mg of ritonavir, total of 3 tablets that you will take twice a day for 5 days within 5 days of onset of symptoms for anyone who is 12 years or older or 40 kg or way more. So this is all about Paxlovid. I hope you find it useful. Thank you very much, and I will see you next time.